Hi, my name is Destiny Thurmer. I'm going to be performing my IV med push with my piggyback skill, following my general principles and safety practices. I would do 2 patient identifiers and assess for allergies. I'm going to nod. Hi, my name is Destiny. I'm going to be your nurse today. We're going to give you some medication. Are you okay with that? The patient gives consent. Alrighty. I would then provide privacy. I'm going to do hand hygiene. I am going to do my 11 rights and 3 checks. I am checking my MAR, pulling out my medication. Okay, I have the medication. I'm checking it to the MAR. Ready? I'm also looking at my MAR and checking this medication. I pulled it, checking it to the MAR, making sure that this is not expired either. Now I am checking that I have the correct patient since I'm in the room. MAR to the correct patient with the medication, and it is the correct patient and correct medication. Also, before I'd give them their medication, I would make sure that it is compatible with their fluids and that these medications are compatible with each other. Okay, I am going to do hand hygiene. Going to put on my gloves. And I am assessing the IV site. There is no complications. The IV site looks good. I'm going to clamp the IV so that the fluids are not flowing. I'm going to start by scrubbing my hub with a clean alcohol pad. Okay, scrub my hub. And now I am getting my saline, taking the cap off. Okay, making sure that there is no air bubbles. Okay, I am going to screw this on. I'm going to push it slow. Before I push it, I'm actually going to check for blood return. Then I'm going to push the medication. Okay, I got blood return. I'm going to push the flush all the way through. Alrighty. I would push this all the way through, evaluating my patient. I would discard this. Okay, I'm going to scrub my hub. Ready? Okay, getting the medication. Making sure that there's no air bubbles. Okay, I'm going to put this on here. I'm going to push it slowly as ordered, evaluating my patient's response to the medication. If they are doing well, I would push this all the way through. Okay. Now I am going to scrub my hub again. New alcohol pad. Okay, throw that away. And I'm going to get my flush. Make sure there's no air bubbles. And flush it through at the same rate as ordered as the medication. Ready. I flushed that all the way through. My patient is doing fine. I'm going to scrub my hub. Okay. And I am going to put on a green disinfectant cap. Alright. I would immediately report my patient's reaction to the medication. I would report and record, and I would evaluate my patient after that. So I'm going to take off my gloves and perform hand hygiene. I am going to give you your other medication as well now. So I make sure I've already checked it to the MAR, and I have my correct patient. So my gloves. Alrighty. The IV site still looks good. I'm going to start by getting out my bag. Okay. And getting out my tubing. going to lower this bag. Ready? I'm going to spike my bag. I'm going to hang this one higher. Now I'm going to remove this cap. And make sure this tube is primed. Alright, it is primed, and I would make sure not that much came out. So I locked it back, and I'm gonna put the cap back on it. And I'm going to hang that up. Now I am going to go to the closest to the IV bag. I'm going to get a clean alcohol pad, scrub my hub, making sure to use a sterile technique. I then would unclamp this, and I would unclamp the IV fluid as well. Okay. Alrighty. Now I would immediately document my patient's reaction to this medication as well. The patient did good. I would report and record. Now, whenever I came back, I would do my hand hygiene, gloves, everything. And this bag is now empty. So the first thing I would do is clamp both of these. Ready? I would remove this medication. Okay, so this is completely empty. I would discard this. Okay. Now I would get a new alcohol pad, scrub my hub, and I would put on a green disinfectant cap. Okay. And then would put this back up here. Okay. Going to clamp this so that the fluids are flowing, making sure everything is good. I'm evaluating my patient. They feel fine. The IV site is still good. I would immediately report and record the reaction to the medication. I'm going to take off my gloves. I would clean up. Hand hygiene, report and record, and then I would come back and evaluate my patient.